Hello, this is Dr. Kenneth Lewis, and this video is specifically for patients who have been scheduled for an epidural steroid injection. An epidural steroid injection can be performed at multiple levels. And on the spine, those are typically described as a cervical epidural steroid injection, a thoracic epidural steroid injection, a lumbar epidural steroid injection, or a caudal epidural steroid injection, which is actually pretty much near your tailbone. In all of those procedures, we are not attempting to specifically identify a precise pain generator, but just a general level within your spine that's uncomfortable. And the goal on that procedure is simply to put an anti-inflammatory, anti-swelling steroid into the epidural space. So if you look at your lower spine, you'll have a spine that has a spinal canal, and inside that spinal canal there's an actual tube with a leathery bag that's containing the actual spinal cord and spinal roots. With an epidural, our job is to very carefully and comfortably place a small needle into the space inside the actual spinal canal, but stay outside of the leathery bag that contains the spinal cord and roots. Now, as anesthesiologists, we have other needles that are designed to go through that bag and place the medication inside that leathery bag of the spinal cord, and that's a spinal block. You're not scheduled for a spinal block. Our medication will go outside that bag, simply in the space around that bag and surrounding the spinal cord inside the actual spinal cord bony tube. We will be entering the spinal cord at a specific site, but we're not treating just that one area. Depending on the volume, we can treat 3, 4, 5, 6 inches of spinal cord in the general area of pain. And so we're going to be treating, as we mentioned before, either a general region within the cervical spine, a general region within the thoracic spine, in the lumbar spine, or in a caudal injection where we actually flood the medication up from the tailbone into the lower spine. All these epidurals can be performed without sedation, but I do recommend that some light sedation be utilized. You'll be more comfortable, and everybody in the room will be slightly more relaxed. With that procedure, what will happen is you'll come in, we'll start the IV, we'll take you back to the procedure room, we'll place you on a procedure table, and monitoring will be in place so we can watch your saturation, make sure that everything is stable. We'll clean off your back with a sterile scrub, and then a very small 27 gauge needle will apply the local anesthetic. For most people, that is very tolerable. Sometimes they don't even know that that's occurred. Once the numbing medication is in place, then the actual procedure needle will be advanced into the epidural space, whether that's cervical, thoracic, lumbar, or caudal. There's a very special system that allows us to identify that space. A small amount of contrast will be injected and looked at with the fluoroscopy so we can assure that it's actually entering the epidural space in the area that we want to treat, and we want to assure that there's no blood vessels carrying that medication out of that space. Once we've identified that the needle is effectively placing the medication where we want and that there's no vascular structures involved, then we will inject the chosen local anesthetic and steroid for the treatment that day. For most people, they won't feel that component there because there's not a lot of sensation of fluid entering that epidural space. Once that part's done, the needle's removed, a small bandage is placed, and you'll go home. For most epidurals, we expect to see some treatment effect within the first 72 hours, but for some people, it can take up to a week. Sometimes it will take more than one session of epidural steroid injections to get a maximal effect. And of course, there's no guarantee that that will be the right treatment for you, but is one of the options that we frequently start with. And that's what you can anticipate if you've been scheduled for an epidural steroid injection. Thank you.